And last year, Dr. Katie Bechman, talked about the changing research landscape of sarcoidosis and some of the trials that were underway. Katie's with us again today. She is a clinical lecturer in rheumatology and inflammation biology at King's College in London and also has a keen interest in research. Earlier this year, Katie published a fairly major research paper in The Lancet called Incidence, Prevalence and Mortality of Sarcoidosis in England, a population-based study. Despite its title, it's actually a fascinating read. So we have asked Katie to join us today to tell us more about this study and what it actually means for sarcoidosis as a rare disease. Katie, over to you.
Okay, so thank you so much for inviting me to talk. So thank you for that introduction. So my name is Katie. I'm a rheumatologist at King's College Hospital, and I'm a clinical lecturer at King's College London. And I have a special interest in sarcoidosis clinically and from a research point of view. And I've changed the title of my talk to say, Understanding Sarcoidosis, What the Numbers Are Telling Us. And I'm going to go through that in some detail now. So I think the most important thing is first to say why understanding numbers can have a direct benefit from patients. So when we talk about numbers in medicine, we really talk about epidemiology, which is the study of how diseases affect people, who gets them, why they occur, and how they can be treated. And really what we're doing in epidemiology is we're looking at patterns across groups of people rather than focusing on individuals. And by collecting and analyzing data, this allows us to see trends and variations and also help improve our understanding of the disease and its treatment. But what is the benefit for patients? Well, it helps patients understand how common is this disease and what are my chances relative to others. On a higher level, it helps it drive health policy. It allows appropriate resource allocation. And really importantly, it allows us to identify specific research priorities. And this helps us understand disease process and also trends in time. Are we getting better at managing conditions? Are patients doing better? So I'm really going to spend the rest of this time talking about how common or rare is sarcoidosis. And this was what a lot of my work tried to address. So I thought I'm just going to give first some background to this. So when we talk about how common or rare a disease is, we really focus on two things. In medicine, we call this the incidence, which is the number of new diagnoses of sarcoidosis, and the prevalence. And the prevalence is the number of people who are living with the condition. So the worldwide incidence, so the number of new diagnoses across the world ranges from 1 to 15 per 100,000 patients per year. So that means if you take a population of 100,000 people, between 1 to 15 of them would have a new diagnosis of sarcoidosis that year. Now, I've given you this massive range of 1 to 15. And that's because across the world, there's a huge amount of regional variation in the number of new diagnoses of sarcoid. And I think that's demonstrated beautifully on this map here. So just to explain to you what we're seeing a map of the world, and the color coding relates to the number of new diagnoses of sarcoidosis each year. So the darker blue colors mean that there is a higher number of new diagnoses, around 10 to 15. And as the color becomes less and less, it becomes lighter, so less dark blue, the numbers reduce. So you can see clearly that in Scandinavia, we have the highest number of new diagnoses. So that's around 11 for Scandinavian countries, so 11 per every 100,000 population. We have slightly lower numbers in the USA and Canada, around 8 to 10. And then you can see here in East Asia, particularly in South Korea, we have much lower numbers, which is around 1 per 100,000 per year. And then you'll notice across the map, there's a huge amount of gray. And that's because we do not have data on those countries. And there will be lots of reasons for that. That may relate to the fact that they don't have the data sources to be able to identify new cases across the entire country. So if we now move on to the number of people living with sarcoidosis worldwide, you see a very similar pattern. We have the highest rates in Scandinavia and in Canada. So that's around 140 to 160 in these countries. So that's 140 to 160 per 100,000 population. And then slightly lower rates in America and Europe. And again, if you think about East Asia, we have the lowest results. So South Korea, Taiwan, and Japan have got a number of patients living with sarcoidosis in their countries around 1 to 5 per 100,000. So you can see there's a huge amount of geographical variation. So now if we focus in Europe and look at that in a bit more detail, again, on the left side of your screen, you've got the number of new diagnoses of sarcoidosis. And on the right, you've got the number of people living with sarcoidosis. And again, in the Scandinavian countries, we have higher rates than we do in Southern Europe. And you can kind of start to see that there's this kind of north-south divide. Now, I've been slightly purposeful here in not discussing anything from the UK. And the reason for that is that the data that made up the data that's incorporated into these maps is from about 20 years ago now. And it was based on data from only 2% of general practices. So you can see that's not very representative of the entire United Kingdom. And furthermore, that data went back to the 1980s. And so it wasn't giving us a contemporary estimate. So we thought it was really important to re-examine the epidemiology, the number of new diagnoses, and the number of people living with sarcoidosis across the UK. And that's because we think that we're seeing more diagnoses, and that may be due to improvements in diagnostic techniques that could have changed the picture. And it's important for us to know how many people are living with sarcoidosis in the UK. And the reason that's so important is it can help ensure healthcare resources are allocated to where they're most needed. It can support effective public health planning, and it can importantly guide future research. So I'm now going to talk about some of the work that we've been doing here looking at these numbers. So what are the latest data and trends? So I'm just going to explain first how we went about looking at these numbers. So we used the Clinical Practice Research Data Link. So this is a really large, secure UK database of GP health records. It provides GP records that are anonymized, so we have no way of identifying patients from these records. And it provides data on 47 million people. So that's about 2/3 of the English population. And we have data from any time a patient is seen at their GP, but we also have data that links that patient to hospital admissions and also to death registrations through the Office for National Statistics. And for this piece of work, we restricted, so we only looked at individuals who were adults, so defined as being over the age of 18. And we also restricted to just looking in England. And the reason for that is because the Clinical Practice Research Data Link is very well represented in England and has less strong representation in Ireland, Wales, and Scotland. And we didn't want to be reporting on the numbers from these countries when we didn't really have robust estimates, where we weren't being representative of those countries. So what did we find? Well, this is a figure that demonstrates along the bottom each year from 2003 to 2023. And for each year, we calculated the number of new diagnoses of sarcoidosis in England. And we reported this as they have around the world per 100,000 population. So in 2003, we calculated that there was around 6 new diagnoses per 100,000 population. And by 2023, this had risen to around 8 per 100,000 population. And that is now really on par with the rates that are reported from Canada and just slightly below what is reported from the USA. Also, as you're looking at this, you can see there has been a gradual increase over time. But what we noted is that the number of new diagnoses was fairly similar between males and females in 2003. And as time went on, we saw an increase in new diagnoses among males. So that's in the orange color and compared to females. And so that was something that had been reported in other countries, but not yet documented in England. So then we wanted to look at what's happening across different age bands. Now, this figure is very similar to the previous figure. We have the year along the bottom, and we have the number of new diagnoses on the left-hand side. And then we have three lines. The purple line responds to the number of new diagnoses in individuals 18 to 40. The gray line at the top is number of new diagnoses in individuals aged 40 to 60. And then we have the blue dashed line in individuals over the age of 60. And as you can see, the highest number of new diagnoses is in this middle age band between the age of 40 and 60. But as time's gone on from 2003 to 2023, we're starting to see an increased number of new diagnoses in individuals over the age of 60. And that's reflected in an increasing average age of presentation. So the average age of presentation with a new diagnosis of sarcoidosis in 2003 was 47 years old. And by 2023, this had increased to 54 years old. So the next thing we wanted to do is look at whether there are differences across England. Now, this is not published work, but I thought this would be very interesting to patients with sarcoidosis. So these figures show the number of new diagnoses by 9 regions within England, and it's plotted at 2003, 2012, and 2022. And as demonstrated in the other maps, the shading of blue going from light to dark demonstrates an increase in the number of new diagnoses. So the lighter blue is a lower number of new diagnoses, and the darker it gets shows an increasing number of diagnoses. And as you can see, 2003, we had generally low level of new diagnosis, and by 2012, that had increased. And then by 2022, that had reduced slightly. And that follows the same trend on the figure that I showed you right at the beginning. But I think what really is interesting with these maps is that there are regional variations. So in 2003, we had the highest number of new diagnoses being made in London. By 2012, we have an increase in the numbers, particularly in the southwest and the east of England. And then by 2022, we have some regional variation with an increased number in the west of England compared to the northeast. And so the last thing that we wanted to look at in this new diagnosis category was whether there were any differences by ethnic group. So this now looks at all individuals with a new diagnosis of sarcoidosis between 2003 and 2023, and it breaks it down by the different ethnicity categories. And you can see that predominantly the new diagnoses were occurring in individuals of white ethnicity, followed by mixed, Asian, and then Black Caribbean or Black African. But I think to really understand the ethnic variation, you have to compare it with the ethnic breakdown that we see in the English population. And we did this by using data from the 2021 census. And you can see that the proportion of Black people with sarcoidosis is almost twice that of the proportion of Black people within the English population. And similarly, the number of patients in the sarco population of mixed ethnicity is nearly 4 times greater than the proportion of people with mixed ethnicity in the English population. So this does demonstrate that there are differences across ethnic groups, and we are seeing more diagnoses in Black, Caribbean, or African and mixed ethnicity patients. So far I have spent most of the presentation talking about new diagnoses. This slide tells us about the number of people who are living with sarcoidosis in England. And again, we have a very similar graph. Along the bottom, we've got years from 2003 to 2023. And along the left, we've got the number of people with sarcoidosis per 100,000 population. And you can see that in 2003, we calculated at a rate of around 160 per 100,000 population. And by 2023, this had increased to 230 per 100,000 population. And so just to kind of give you an idea of what that means, if we'd say 230 people per every 100,000 people, that means that 1 in every 435 people has sarcoidosis. Now, we think this is a vast overestimation of the number of people living with sarcoidosis. And the reason we think we've overestimated it here is because we had very vague requirements. So patients only needed to have one ever medical record of sarcoidosis via their GP. And so it's quite possible we picked up people who've been misclassified or don't have a firm diagnosis. So when we use the more stringent category, which is individuals who required at least 2 codes for sarcoidosis in their medical records, which means they would have been seen by their GP or possibly in hospital with a complaint or something relating to sarcoidosis, we got a value of 121 per 100,000 patients in 2023, which brings the level down to 1 in every 826 people. And I just have to say that we think that the true number of people living with sarcoidosis in England is probably somewhere in between these two values. But that does bring us onto the same rates as what's seen particularly in Switzerland and Canada. So I've talked to you about some of the data, and now I'm just going to try and discuss why we might be seeing some of the differences. So I think the first thing is to talk about the rising rates. Why are we seeing increases in new diagnosis and increases in the number of people living with sarcoidosis? So I think the first thing to say is that it's quite possible we're getting better at diagnosing sarcoidosis. We now have better scanning equipment and imaging techniques. So here I put a picture of a CT PET, which is often used to diagnose individuals who've got multi-system sarcoidosis. We also have better ways at obtaining biopsies if we need to take tissue from the lung. And so that may be improving why we're getting an increased number of new diagnoses. We also, among the medical community, have improved awareness of sarcoidosis. We have clear guidelines, which means more doctors are likely to recognize and, importantly, record the condition. And it's possible that there may be unexplained changes in the environment that's not yet fully understood. So what about these differences across countries and also differences within the same country? Well, we know that there are some families or ethnic groups that are more likely to develop sarcoidosis, and they may be living in different regions across the world or within the UK. It's possible that there are local environmental influences. We know that sarcoidosis has been associated with exposures to dust, certain infections or occupations, possibly air quality or climate, and also it's been postulated that lifestyle differences may play a part. But I think this is really important, and especially as a kind of epidemiologist, I find that this is a really important thing to focus on, is that estimates can also differ on the data sources used and how sarcoidosis is defined. So in our work, we use GP data, but other studies have used hospital records where possibly you have more firm diagnosis. And even further from that, some studies have only included patients who have biopsy-confirmed cases. And so you can see how this could cause vast differences in the numbers that we're seeing. So what about noticing an older age at diagnosis? So more people being diagnosed in later life. What would be the reasons behind this? Well, it's possibly due to the fact that this is an older cohort of patients who have more interactions with medical professionals, which means they're having more medical checks and potentially more scans, where we may be picking up incidental findings and diagnosing sarcoidosis that may have been asymptomatic. And it's also possible that older adults with sarcoidosis behave differently, and they may have age-related changes in their immune system that may be causing this. And this is something that hasn't yet been researched in more detail. So the last part of this presentation, I wanted to focus on living with sarcoidosis or survival with sarcoidosis. And this was the last piece of the work that we conducted. So what do we know already about living with sarcoidosis and survival with sarcoidosis? Well, studies so far have shown us, and these studies are now 20 years old, but they did identify that the death rate in individuals with sarcoidosis was gradually increasing over time. And also that people with sarcoidosis were found to be twice as likely to die when compared to people who did not have the condition. And when these studies came about, you can see here in 2006 and 2011, they were based on data from 20 years prior to that, but they highlighted the need for better treatments and better long-term care. And because of this concern about a rising rate of death, we wanted to re-examine this and see whether we have noticed improvements over time. So again, we have the same type of figure where we have year across the bottom, and this time we now have the number of deaths from any cause in patients with sarcoidosis along the left-hand side, and this is reported per 1,000 patients. And reassuringly, you can see there had been no increase in the risk of, or the rate of death from any cause in individuals with sarcoidosis. So that's reassuring, and there was no increased risk when we looked individually at males or females. Just to point out, these blips here relate to the COVID-19 pandemic. So what about when we compared the risk of death to the general population? Well, we found that there was a slight increased risk of dying from any cause. It was lower than had previously been documented, but we found that men were 1.8 times more likely and women 2 times more likely. I think it's really important to point out here that we are looking at all individuals across England diagnosed with sarcoidosis. And sarcoidosis is a very varied condition. And whilst many people have mild disease and live completely normal lives, our figures also included those who had more severe or life-threatening forms of the condition. But this continues to highlight the need for early diagnosis, careful monitoring, and improved long-term care to make sure that we bring these rates down for our patients. So what is the future research in this area? Well, I think the most important thing to state is that we are learning more than ever about sarcoidosis. And I think this is really, we have seen huge amounts of change in research efforts over the last 10 to 15 years. We have new studies looking at why it develops, looking at links with the immune system, our environment, and genetics. We also have more data that helps us map how the condition varies across region, and we're trying to really understand how it differs across communities and different ethnic groups. And we now have in the UK improved digital health records, which for epidemiologists like myself means that we have far more greater chance to look and study the long-term outcomes and treatments for patients with sarcoidosis. So to summarize, I've spoken about a lot of data here, but I have tried to demonstrate the number of new diagnoses and the number of people living with sarcoidosis in England from our recent research, and demonstrated that these numbers have increased gradually over time. And we now think that our rates in England are very similar to what's been reported in Canada and the USA. I've also shown that we have noted changes in the distribution in age and also in sex, and there are regional and ethnic variations, and we are very keen to do more research looking into these areas. Oops. So I think I'll stop now and take any questions that there may be.
Okay, I'd like to throw a question at you which I didn't share with you in advance, if that's okay. It's come in the chat while you've been talking. I don't think it will be ambushing you with it, but may I ask it anyway. Has incidence of sarcoidosis increased since the pandemic? Or is it just we have greater imaging being used post-pandemic that's led to more diagnoses?
Yeah, so interestingly, and you would be able to see it from our figures, but actually we saw that there was a slight drop in the incidence since the pandemic. Um, Whether that relates to some delay in patients presenting with their diagnoses, and we haven't explored that more, but what we haven't seen is a sharp rise in new diagnoses. And really, the greatest rise that we saw was from 2012 to about 2017. And then we start to see a slight drop in new diagnoses. So I don't think the pandemic's had a big impact, but it'd be very interesting to look what happens in the next 10 years and see how the trend changes over time.
Okay, thank you. Now, obviously, your research is England-centric.
Yeah.
Is there similar research taking place in the other sort of devolved countries, or and are results varying there at the moment?
So I apologize for people who are in the other countries, and really just to explain in a bit more detail. But the CPRD dataset provides data from general practices, and it's linked into the type of software that the general practice use. And so within England, there's using a lot of the same software that feeds into the CPRD, and that's why we don't have good representation elsewhere. And it's unfortunate because really what we wanted to do initially was look across the UK, but we felt our results would be misleading. And I'd be really interested to see what's coming out from other areas to see whether it's on par with what we're seeing in England. There have been other research studies. So I know that the BTS sarcoidosis registry includes some centres from Scotland, but doesn't normally report individually from Scotland. And I know that there have been studies from Ireland. These date back to the late 90s, but there have been studies showing incidence and prevalence rates from Ireland, but nothing more contemporary than that.
Okay. Well, we've recently started a new support group in the Isle of Man because we have discovered an abnormal number of patients, it seems, in the Isle of Man with sarcoidosis. Now, there's obviously a strong historic link from the Isle of Man to Ireland. That may be a factor, but how does Ireland compare to UK prevalence, given we are very, very similar demographically?
Yeah, so I think the first thing to say is that there is prevalence data from Ireland. It's quite outdated now. The prevalence at that time was probably quite similar to what we saw at the beginning of our prevalence estimates from 2003. So I think that it has to be compared again, and really I'm talking about comparing very outdated data sources. The interesting thing about the Isle of Man is that I noted after I saw this question, I went back and saw there was a really interesting study from 1985, so it's quite a long time ago, that looked at the number of new diagnoses in the Isle of Man. And it was very interesting what they did. They went and asked all the GPs to look out for new symptomology and highlighted new diagnosis of sarcoidosis. And in doing that, they quadrupled the number of new diagnoses that they were seeing. And so they got a huge increase in the number of new diagnoses just from that study, which just demonstrates, how you can influence new diagnosis by improving education around conditions that aren't seen so frequently. And so I think there has been a lot of effort in the past at recognizing sarcoidosis, and that probably has influenced why the number of new cases in the Isle of Man is quite high. But with my epidemiology hat on, I always am thinking whether there's something in the environment or something in the genetics that is the reason why we're seeing regional variations and higher rates in certain areas of the country.
Interesting, because obviously also there's question around environmental factors which also affect geographical areas. And one example, I think we often hear that Plymouth appears to be a hotbed of sarcoidosis, but the only obvious reason there could be docking and the ship industry that's down there. But is there any other examples of that you're picking up in research where there's a specific geographical or environmental factor?
Yeah, so I mean, I presented these regional variations across the UK, across England. And it's an area that we're quite interested in looking at in a bit more detail. What is really hard to pull apart is how much of this is due to just improved diagnosis, which may be center specific, and how much is due to environmental and genetic exposures. I know that, this is the pattern we see in England is actually the pattern you see in other countries as well. And I have seen some studies that have looked at environmental exposures and how that associates with increased diagnosis. And I think pulling that apart can be quite difficult, but I think that's a really interesting area.
Okay, my last question, you'll be believed to know, it's back to your international map with all your grey pieces on it, and also the dark colours, which obviously meant higher prevalence. There does seems to be a vast variance as we travel the world. Now, I get that different reporting is taking place, we're using different health systems, different metrics are being used, but is there anecdotally anywhere where there is no sarcoidosis? And equally, is there anywhere which has got a disproportionately high diagnosis? If so, what does that mean?
Yeah, so we've always felt that the northern hemisphere, particularly to do with altitude, is associated with increased rates of sarcoidosis. And I think that probably relates to a combination between genetics and also environment. There have been some links to whether this is related to climate changes. We can't say for sure if we aren't seeing, that there are, my personal opinion is there are patients in other countries that have sarcoidosis and we're just not capturing it. There definitely will be geographical variation depending on genetics and environmental triggers, but I think probably this is a worldwide disorder, and it's just that in certain regions we're seeing higher rates than others. And I doubt there is a country that doesn't have any rates of sarcoid.
Okay, well, thank you very much, Katie. That was so well presented to make it totally layman friendly. Thank you, because I did read your original report and I was quite concerned how you presented it. That's absolutely perfect. So thank you for making it accessible to all of us, particularly those of us who don't do maths like you do. And a big thank you also to everybody who's been involved today, including Mary and Eva, who have been keeping things running so smoothly behind the scenes. The fact we haven't seen them pop up means it's been going well. So thank you, both of you.